prostate cancer. Just hearing those words can make your heart skip a beat. For men over 60, it's more than just a medical term. It's a reality we all have to face at some point in our lives. Maybe you've lost a friend to it. Maybe you've sat in a doctor's office, staring at a chart, wondering what comes next. Or maybe, and this is more common than you'd think, you've spent years listening to rumors, half-truths, and myths that swirl around the topic like a storm cloud. Today, I want to clear the air. I want to talk about 7 of the biggest myths surrounding prostate cancer that most men still believe, and why clinging to these myths can be dangerous. Let's be honest, men aren't always great at talking about their health, especially when it comes to something as personal as the prostate. It's easy to push the topic aside, to assume what you've heard is true, and to convince yourself that it won't happen to me. But what if everything you thought you knew was wrong? What if the myths you've picked up over the years are actually standing in the way of early detection, better treatment, and, most importantly, peace of mind? So, grab a cup of coffee, settle in, and let's tackle the 7 prostate cancer myths most men still believe. Because when it comes to your health, there's no room for misinformation, and there's never a bad time to learn something new. Myth number 1. Prostate cancer is an old man's disease. It's easy to believe that prostate cancer only affects men in their 70s or 80s. After all, it's something we associate with old age, retirement, and, let's be frank, slowing down. But the truth is, while the risk does increase with age, prostate cancer doesn't check your birth certificate before it shows up. Men as young as 40 can be diagnosed. In fact, research shows that while most cases are found in men over 65, nearly 35% of diagnoses happen in men younger than that. Why does this myth persist? Maybe it's because, as men, we don't want to think about the possibility of illness before we're old. It feels safer to put it off, to assume we're not in the danger zone yet. But the reality is that early detection is key, and ignoring symptoms or putting off screenings because you think you're too young can lead to missed opportunities for treatment. Think about the men you know, your friends, your brothers, your sons. Prostate cancer doesn't discriminate based on age the way we wish it would. That's why it's so important to talk about risk factors, family history, and symptoms, no matter how old you are. Don't let the idea that it's an old man's disease keep you from taking your health seriously. Myth number 2. No symptoms means no cancer. How many times have you heard this one? I feel fine, so I must be fine. It's comforting, isn't it? But it's also one of the most dangerous assumptions a man can make about prostate cancer. In its early stages, prostate cancer often shows absolutely no symptoms. You can go months, even years, without noticing a single change. By the time symptoms do appear, like trouble urinating, blood in the urine, or pain in the hips or back, the cancer may be more advanced. This silent progression is what makes prostate cancer so tricky. Unlike a broken bone or a cold, there's no pain, no immediate warning sign telling you something's wrong. That's why routine screenings like the PSA blood test are so important. They're not just for men who feel something is off, they're for every man, especially those over 50, or younger if you have a family history. If you're the type who avoids the doctor's office because nothing hurts, remember, prostate cancer doesn't always let you know it's there. Don't wait for symptoms. Don't gamble with your health. Regular checkups are your best defense. Myth number 3. Only men with a family history get prostate cancer. It's true. Having a father or brother who's had prostate cancer does increase your risk. Genetics play a role, and men with a family history should be extra vigilant about screenings and lifestyle choices. But here's the twist. More than half of men diagnosed with prostate cancer have no family history of the disease at all. So, why do so many men believe they're safe if nobody in their family has had it? Maybe it's wishful thinking. Maybe it's relief. But it's not the reality. Environmental factors, lifestyle choices, and even random genetic mutations can lead to prostate cancer. You can eat well, exercise, avoid smoking, and still find yourself facing a diagnosis. This myth is especially harmful because it gives men a false sense of security. It convinces
them to skip screenings, ignore symptoms, or brush off concerns. The truth is, every man is at risk, family history or not. If you fall into the trap of believing you're immune, you might miss the early warning signs. So, whether or not prostate cancer runs in your family, make sure you're proactive about your health. Myth number 4, prostate cancer is always slow-growing and not life-threatening. Here's a common belief. Prostate cancer is a good cancer, if there's such a thing. It's slow, growing, easy to treat, and most men die with it, not from it. Now, it's true that many cases of prostate cancer are slow-growing and may never cause symptoms or threaten your life. But not all prostate cancers are created equal. Some types can be aggressive, spreading quickly to other parts of the body. These forms can be life-threatening if not caught early. The problem with this myth is that it encourages complacency. Men hear slow-growing and think they have years to worry about it, years to put off treatment or skip follow-ups. Imagine being told you have cancer, but then hearing, "Don't worry, it's not a big deal." That's confusing, and it's not always true. The key is to talk to your doctor about your specific case, about the stage, the grade, and the best plan for you. Don't assume every prostate cancer diagnosis is the same. Some men need immediate treatment. Others may be safe with active surveillance. But that decision should be based on facts, not myths. Myth number 5, treatment always leads to impotence and incontinence. There's no getting around it. Prostate cancer treatment can be scary. Surgery, radiation, hormone therapy, these words come with heavy baggage. Many men believe that choosing treatment means signing up for a life of impotence, incontinence, and loss of control. It's one of the biggest fears men have, and it's easy to see why. But the truth is, advances in medicine have changed the landscape. New surgical techniques, targeted radiation, and improved support systems mean that the risks of permanent impotence and incontinence are much lower than they used to be. Yes, side effects are possible, and every man's experience is different. But many men recover sexual function and bladder control over time. Some never lose it at all. The myth that treatment always destroys your quality of life keeps men from seeking help, from asking questions, and from considering their options. It's important to talk openly with your doctor about risks and benefits, about new technologies and rehabilitation. Don't let fear keep you from making the best choice for your health. And remember, you're not alone. There are support groups, counselors, and resources available to help you through the journey. The worst thing you can do is suffer in silence or avoid treatment altogether. Life after prostate cancer can be fulfilling and joyful, even if there are bumps along the way. Myth number 6, and AMP. Quote, if you have a high PSA, you definitely have cancer and AMP. Quote, the PSA test, a simple blood draw that measures prostate-specific antigen, is one of the most common tools for detecting prostate cancer. But it's also one of the most misunderstood. Many men believe that a high PSA score is a death sentence, a guarantee that they have cancer. That's simply not true. PSA levels can rise for a number of reasons: infection, inflammation, even recent sexual activity or cycling. While a high PSA can be a warning sign, it's not definitive. Many men with elevated PSA scores do not have cancer. That's why doctors use PSA levels as just one piece of the puzzle, combining them with digital rectal exams, biopsies, and imaging studies to get the full picture. Jumping to conclusions based on a single test can lead to unnecessary anxiety and, sometimes, unnecessary procedures. The key is to look at trends over time, to consider other factors, and to work closely with your healthcare provider. Don't panic if your PSA is high. Don't assume the worst. Get the facts, ask questions, and make decisions based on your unique situation. Myth number 7, prostate cancer is a death sentence. Let's address the elephant in the room. For years, men have whispered about prostate cancer as if it's the end of the road, as if a diagnosis means your days are numbered. But that's far from the truth. In fact, prostate cancer has one of the highest survival rates of any cancer. More than 98% of men diagnosed with localized prostate cancer are still alive 5 years later. That's not a death sentence. That's hope, of course. Every case is different. Aggressive forms can be more challenging, and advanced disease requires careful management. But with early detection, innovative treatments, and ongoing research, men are living longer, healthier lives after a diagnosis. The myth that it's all over leads to despair, fear, and sometimes refusal to seek help. Don't let it rob you of hope. If you or someone you love is facing prostate cancer, know this. There are options. There is support. There is life after cancer. And every day, doctors and researchers are working to make outcomes even better. So, what can you do? How can you separate fact from fiction and take charge of your health? First, talk to your doctor. Don't wait for symptoms. Schedule regular checkups, ask about screenings, and discuss your risks. If you have a family history, be extra vigilant. If you're over 50, make sure you're on top of your health. Second, educate yourself. Read, ask questions, and don't be afraid to challenge what you've heard. Myths thrive in silence and ignorance. The more you know, the better prepared you'll be. Third, support each other. Talk to your friends, your sons, your brothers. Prostate cancer isn't just a personal issue, it's a family issue, a community issue. The more we talk, the more we share, the stronger we become. And finally, remember that you're not alone. Millions of men have walked this path before you. There are support groups, counselors, and resources available. Don't let fear keep you from reaching out. Let me close with this. Prostate cancer is tough, but so are you. Life after 60 comes with its challenges, but it also comes with wisdom, strength, and resilience. Don't let myths rob you of hope, health, or happiness. Get the facts, get the support, and take charge of your future. If this video helped you, don't keep it to yourself. Subscribe now, leave a comment about your experience, and share this with a friend who might need it. Your story could be the one that saves a life. Let's fight these myths together. Let's fight prostate cancer together. And
let's live better, longer, and stronger, because you deserve nothing less.